Wilcoxon sign, and then again we'll go to the breakout room. So till now we have done the association between two variable, association between two categorical variable, and association between two continuous variable, where we did the various chi-square test and we did the correlation statistics, Pearson's and Spearman for two variable and for multiple variable. So now we will be doing the comparing the mean or median in two groups or more than two groups. And that is the agenda for today and tomorrow session. So today's session, we are going to cover the one sample t-test. So there is no question of this one sample t-test. I'll just be demonstrating it. And then I'll be showing you the independent sample t-test over the gem movie. And then if the data is not normally distributed, then we definitely, instead of independent sample t-test, we use the Mann-Whitney U test. So I'll be showing you how to apply and interpret the Mann-Whitney U. And then we'll see the paired t-test and its non-parametric counterpart, that is the Wilcoxon sign rank test. So starting with the one sample t-test. So if you can recall the chi-square goodness of it. So in chi-square goodness of it, that was also a one sample test, where we used to see the categorical variable, the proportion of a categorical variable against a known proportion. So if that hypothesized proportion is not available, we used to take the equal. If the hypothesized proportion is available, then we used to enter that value. One sample t-test is exactly the same. But here, because it's not a categorical, so you are comparing any sample mean against a known standard. So the basic concept is like there is a one sample. That's how its name is. Because usually when you compare mean, you have got two groups or more than two groups. But in this case, one sample test, you have got a one sample, you've got a one group, and we call it as a t-test because we are comparing the mean value of a continuous or a scale variable with a known or a hypothesized value. So what can be the research question? So suppose if in my institute, I have applied a new teaching method, and I want to see whether this new teaching method can improve the mean marks obtained as compared to the institute mean marks. Then I can say that with my teaching method, what is the mean marks and what it used to be the previous, and then I can compare it. Again, if I want to compare the hemoglobin level of my sample population against a known standard, maybe a NFHS data or some other data, or if I want to see whether there is a difference in the mean depression score between sample and population. So here the other group, we take it either a known standard or a reference population, and we have got a sample mean. So in all these cases, what have you observed? That there is a scale variable in each research question, and I want to compare this scale variable, which can be a known or a hypothesized value. So appropriate statistical test for such type of analysis is the one sample t-test, also known as the single parameter t-test. So it is known as the single sample t-test, single parameter t-test, or one sample t-test. And there are some underlying assumptions before we can apply this test. So the first assumption is that there should be one dependent variable which should be measured on the continuous scale, because you are comparing a mean. So from now onwards, we will not be talking regarding a categorical variable. Yes, that grouping variable can be a categorical, but the dependent variable will always be a continuous variable. So in this case, the dependent variable is a continuous variable which is measured on a scale, which is measured on a continuous scale. And this variable should be approximately normally distributed, because this in one sample t-test, independent sample t-test, these usually we apply when the data is normally distributed. And again, like all other tests, here also there should not be significant number of outliers. So by this sentence, it doesn't mean that there cannot be any outlier. There may be outlier, but you need to define that it should not be a significant number. So we have done this concept earlier also. How do we define outlier? So now for outlier, you have to plot a box plot. It can be a extreme outlier or can be a normal outlier. So in SPSS, SPSS gives you the value of this both the extreme as well as normal. Whereas if you see the GEMOV, it only gives you the value of outlier. It doesn't differentiate like which is the extreme and which is the normal outlier. And we have done in the day one that while doing the descriptive statistics, the point which is more than 1.5 box length from the margin. So these 2 points we have calculated as like this is the Q1 minus 1.5 times interquartile range, and this point is the Q3 plus 1.5 times interquartile range. And if your values lies beyond these two values, then we call it as a outlier. So what is the hypothesis? So hypothesis is that population mean, which we have estimated from a sample, that should be equal to the known population. And here the population mean, which we have estimated from a sample, is not equal to the known population mean. So this is the null and alternate hypothesis. So if I want to, before I go to the independent sample t-test, I'll just show how you can do this test over GEMOV. So this is my data set of GEMOV. And if you see the variables, so this is the variable view. You can see it is name, gender, socioeconomic status. There are various comorbidities, and then there are scale variable like all the parameter, diastolic, systolic blood pressure, pulse rate, vitamin D, cholesterol, etc. So these are my variables. And this 1 and 2 is because we have taken repeated twice or thrice those values. Here you can see there are 2 values. So these are the measurements of the scale variable. Now coming to this analysis, if you click this analysis, you can see that here we have used this, till now we have used this option of exploration where we have seen how to plot a descriptive, how to do a descriptive analysis. Then we have seen this frequencies where we have learned regarding the chi-square goodness of it, chi-square test of association. And today we'll see this option, that is the t-test. So if you click this option of t-test, so can you see here, you can see there are 3 types of t-test which has been mentioned here. So there is an independent sample t-test, there is a paired t-test, and there is a one sample t-test. So I'll show this one sample t-test. So if you click this, see the interface. So you have got one variable here. So maybe if I want to see regarding the systolic blood pressure, I want to see what is the mean BP. If I say like the mean BP of all patients who have been admitted in my ward, is it different from maybe if a national average, or if maybe the state, or if there is another hospital where the mean BP is 140. So I want to say regarding the mean BP of my patient. So I have transferred this variable here. And then you can see this student D is already ticked. And then if you want to click the mean difference and its confidence interval, that you can write here. But again, here you have to write the hypothesized value. So maybe if I am writing here 140, and before you write 140, you need to check the normality test. Why we are not doing normality? Because the sample size is more than 50. So I'll be checking this QQ plot. So just see, so with this QQ plot, you can see that the data is approximately normally distributed because most of the data points are lying on this diagonal line. So I can apply this independent, this one sample t-test. Else, if this data was not normally distributed, I will have to tick this Wilcoxon rank, which is the non-parametric counterpart of the one sample t-test. But since the data is normally distributed, I have just unchecked this. And you can click on the descriptives. Descriptive will give you the mean of this value. And then you can also click on the effect size. So you can see here that this T statistics. If you see, this mean of this 180 sample is 129.56. And I have to compare it against a known standard, which is 140. So yes, if you see the P value, you will see that this is significant. First, I'll see this change. So this P value is significant. That says that there is a difference of minus 9. This is the T statistics basically. So you can see the T statistics, there is a minus sign. So minus sign means this does what this GEMOV does. It takes this variable minus your hypothesized. So the mean of this is 129 minus 140. It will give you the negative sign. So negative sign of T only says, because we do mean 1 minus mean 2. So when the mean 2 is bigger, then this T sign will be negative, or vice versa. If T sign is positive, that means mean 1 is bigger. And then this value of P is significant here because the mean difference of blood pressure is minus 10.44 with this lower and upper boundary. And this sign of the T statistics does not matter. It only tells you regarding which mean is bigger. And with the descriptive, you can see that which mean is bigger. And then with the effect size, this is 0.70. So remember that this is the Cohen's D, and the effect size, we say when the effect size is 0.3, we say it is a minimal effect size. Up till when we say it is up till 0.5, we say it is moderate, and when it is up more than that, we say it is a good effect size. So in this case, it is 0.7, so we can say that it is a good effect size. And remember what we have talked regarding the effect size. So effect size says that first you see the descriptive. So descriptive says that the mean difference of my sample is 10, like my sample mean is 10.44 millimeter of mercury less than the reference mean, and which is clinically significant also. It is significant both statistically and clinically. So your Cohen's D tells you the clinical significance of this value, because there can be a scenario when there is a statistical significance, but this effect size is not there. Okay, there can be, you will see that there may be a situation when this effect size is very less, like 0.1, 0.2. In that case, you will write that yes, there is a statistical significance, but the effect size is so small that it is clinically not very significant. In the other words, but again, be cautious. If there is no statistical significance, then you are not going to comment on the clinical significance. So the first prerequisite to comment on Cohen's D is that your result should be statistically significant. Okay, then only you can comment on the Cohen's D or the effect size.
Ma'am?
Yes,
hello.
Ashish?
Yes, ma'am. Ma'am, in SPSS, we don't have Cohen's D, right, ma'am, when we try to do interpretation of one sample t-test?
Yes,
Am I right?
actually, yes, Ashish, you are very right. The newer version of SPSS, like
Okay.
we were the version which we are having, that is 22, but after 27 and onwards, now they have. So in SPSS, you have to calculate it manually. It doesn't come automatically. But
Okay,
in case of a GEMOV, the effect size option is there in all the program, all the options. And in SPSS also now they have included it. So people who are having 27th or more version, there is a box of effect size, and if you click that, you will get this.
Okay. Ma'am, how do we interpret Cohen's D? Like this is minus 0.70. So
That's what I was
how?
telling Ashish. I guess maybe you could not listen what I talked. So effect size, we always talk in context of its value. So it is minus because it is the same as like, T statistics. So don't go by the minus sign. You have to go by the value. So like, remember we used to interpret this Kramer V. So
Yes, ma'am.
similarly here, if the value of this effect size, it is up till 0.3, we say that it is clinically very insignificant. If it is up till 0.5, we say that it is moderate effect size. And if it is more than that, we say it is a good effect size. So 0.7 is a good effect size. That means clinically this difference of 10 millimeter is clinically significant for me.
Okay, ma'am. Thank
It
you.
is statistically also significant, but it has got clinical significance also. Because remember, if you just go and read the sample size calculation, and maybe if you can see the R sample size calculation videos, there we always talk about what can be the disadvantage of taking too many samples. Like NFHS data, if there are many sample in your data, then even a small difference, it will be highly significant. Like 1 millimeter, 1 point, even 0.5 millimeter will be highly significant because of the sample size. So, but if you just see the effect size, it will not be significant, because for a clinician, if a new drug is improving, decreasing the blood pressure by 0.5 millimeter, he's not going to achieve anything. That's why, along with the this statistical significance, we need to report this effect size, which will tell you the clinical significance.
Madam, one question, please. The
Yes, Ravindra?
the effect size must be related with the standard of blood pressures then? By clinical
Yes.
significance.
Yes.
Standard of blood pressure, that means it also changes. Different recommendations give the different standards. So they have to change the value in that case, probably.
Actually, no value. There are various types of effect sizes. Like there is a Cohen's d, there is a Hedges G. If you come to ANOVA, you will see there is a pseudo this thing, the eta square, partial eta square. So do you want to convey regarding the various type of effect size, or you want to say that if we change the value of this test value, then effect size will change? Do you want to say that?
I want to say that when you were talking about the clinical significance,
Okay.
clinical effect. So as we know, the clinical effects of blood pressures is related with the standards, standard of hypertension. That means the different standards.
Okay.
So is it that it is indicating?
No, this is not indicating that. This is just saying your sample data, the data which you have taken from the population, whether it can be, when you practice evidence-based medicine, whether the result which you have taken out, whether it should be practiced or not. So if with the different standards, it does not do, because standard in context of what? Like maybe if you can clarify a little bit more. Like JNC, like you, if you're talking like JNC 7 or JNC 8 or something like that.
Yeah, I am talking about that JNC 7 or JNC, whatever it may be. So
No,
it's not related with that.
nothing to do with those standards. That is though, if you have diagnosed someone as a hypertension, or if like it is basically in context of randomized control trial or mean changes, when you are proving that this drug is better or inferior, or maybe when you are saying that the mean change is more or less with a particular intervention, then you have to say this. Otherwise, in case of in context with standards, it has got nothing to do. Is it okay?
Okay.
Okay. So this was the independent, this was the one sample t-test. So if you have, if you are okay with it, so are you people with me up till this point? Then I'll go to the independent sample t-test. Have you understood this? This all values, the student t, the statistics, then p-value, probably the degree of freedom, and the mean difference, the Cohen's d, and then descriptive. So, okay. So if that is okay, I'll go to the independent sample t-test. So this independent sample t-test, now in this case, we call as independent sample. So independent samples, because there are two independent groups. And in this case, you will again listen about the independence of observation. So it is because the two groups are independent, and you are comparing the mean value of a continuous or scale variable across these two groups. That's how its name is independent sample t-test. So what are the research questions for which you can apply this test? So suppose you want to compare the average BMI value of a population, and you have got two set of population, people with cardiovascular disease and people without history of cardiovascular disease, and if you want to compare the mean BMI. So in this case, you can see that this is a categorical variable, and this average BMI is a scale variable, and the population with history and without history is a categorical variable. So there are two categories, and you are comparing a mean in between these two categories. Similarly, if you want to compare the pain score on visual analog scale after surgical technique 1 versus surgical technique 2, then again here the same thing, this pain score we have taken measured as a continuous scale. And you can see this pain score is measured as a continuous scale, and this surgical technique 1 and surgical technique 2, this is your two categorical variable. So in all cases, you can see this again, good quality of sleep that is measured a person who have a good quality of sleep and a poor quality of sleep. So these two are the categorical variable, good quality and poor quality. And you want to see the sleep, the score in the exam. So the score in the exam is your continuous variable. So in all these example, you have seen that you are comparing a continuous variable or a scale variable across two categories. And so there is a continuous variable in each research question and you want to compare mean of this across two categories. Then in this case, the appropriate statistical test is the independent sample t-test, also known as the unpaired t-test. It is known as the student t-test, between subject t-test, or unpaired t-test. So there are three research designs which are basically possible when you can apply this type of test. So if you want to compare the mean difference of the two independent group, then you can apply this test. As for example, in this case, you will see that there are like 1, 2, 3. There are 3 males and there are 1, 2, 3, 4 females. So now if you want, these are the mean cholesterol level. So if you want to compare the mean cholesterol levels of female and male, then you can do this type of independent sample t-test. Or if you want to compare the mean differences between two intervention, as for example, you are doing a randomized control trial, you have got two groups, like there is an intervention group and there is a control group, and you have got the cholesterol values of these people. And if you want to compare the mean difference, like if you want to take this as one group, so whole intervention, you will want to compare the mean cholesterol between this intervention and then in the control. So if you want to compare these two groups in the context of the mean cholesterol, then you can apply this independent sample t-test. And the third type of research design, which is where you can apply this, that is the mean difference in the change score. So like if you have got something, as for example, in this case, you can see that this is again the same. There's a randomized control trial and you have given some intervention and you have measured the serum cholesterol level before the intervention and after the intervention. So you have measured this serum cholesterol twice. So here you have measured that this is the pre-intervention serum cholesterol and this is the post-intervention serum cholesterol. And you have calculated the difference. So this is the difference between the pre and post. So this is the value of the difference of overall the intervention group. So this is the difference and this is the difference of the control group. Now, if you want to calculate the mean difference in the change score, so you are comparing the mean difference of this change score, then also you can apply the independent sample t-test. So there are certain underlying assumptions for this.
Ma'am, there is a confusion right now over here. I have a confusion. Like in the just previous example, which we were saying intervention and control, you were saying that use independent t-test. But ma'am, like before, after intervention, why not paired t-test, ma'am? Why?
I was expecting this question. So see, there are two things here. If you want to compare this
pre and post, then we will do
pre and post. So if I want to compare this 180, this total mean, there will be one mean of this group and one mean of this. So if you want to compare in one group, the pre-post, then you will apply pair t-test.
Exactly.
But here I am comparing, I have taken out the difference. So this mean difference, if I want to say that which group improved better, see, wherever there is a more change score, it will have a improvement more from pre-post. So you can comment only for a single group. Now you cannot compare for the whole this thing. So
okay, we have two groups over here, intervention group and control group.
Yes, it is not the same group. It is not a paired. There are paired values, but the paired value will be only counted for intervention separately. So you can apply separately. You can apply paired t-test only in the intervention group, pre-post.
Okay, ma'am.
Only in the control group pre-post. But if you want to compare overall, like because of my intervention, which group has improved better, the control group or the intervention group, then definitely you need to compare the change score, isn't it?
Ma'am. Yes, ma'am.
Okay, thank you. Everybody else, did you understand or still any confusion? Okay, if not, then I'll go ahead.
Yes, ma'am.
So the underlying assumptions are like the first assumption is there is one dependent variable which is measured on a continuous scale, like we have seen with so many examples right now. And the independent variable, it is always a categorical variable having two categories, dichotomous. If it is more than two, then we'll see tomorrow, then we have to apply the ANOVA with the same sort of dependent variable. And assumptions are again, there should be independence of observation, means both the groups should be independent to each other. They should not be related to each other, because in pair t-test, we'll see that the two groups are related. That can be same individual, which is measured like pre and post, which Ashish was talking now. So here the observation are entirely independent. And in this case, sometimes we also say that you should not say, like, if I'm doing something over male and female, so I cannot take a couple where in female, I'll put all the females in one group and all the couple, the male counterpart in the other group. That will not be an independent group, because although you have counted one individual in only one group, but still they are related to each other somehow. So that's how the independence of observation, it also states that they should not be related to each other. Twins, if there are two people, twins, then you should not take these twins in two separate groups or in this thing, because they are not, related to each other. So we ensure that the groups should be separate and it should not be related to each other. Other assumption is the dependent variable should be approximately normally distributed, which we have seen for the others, this thing also, and there should not be significant number of outliers across this independent category. And then another concept is the homogeneity of variance, which is also known as, sometimes it is known as the homoscedasticity. So this homogeneity of variance, it states that the variance, so remember the first class, we will discuss variance tomorrow also, but variance is the mean square. Remember, we have like subtracted the mean from individual and then we squared it and then we have sum. So sum of mean square, that is known as the variance. And when you take the square root of that, it gives you the standard deviation. So this variance, that should be equal for each of the two groups, because we assume that from population where have you withdrawn these two samples, they are almost similar, so they have come from the same population. That's why the variances of these two populations should two samples should be same, and that we test on by the homogeneity of variance. So in Jamovi, again we have talked regarding this QQ plot and this Shapiro-Wilk test. So this, I think, yes. So there is something known as the robustness of this t-test. So many times you will see that even if your data is slightly not normal, then also you can apply this t-test, because this t-test is robust. And even if the data is approximately normally distributed, not entirely, then also you can apply this test. And there is a central limit theorem which says that if you increase the sample size, then even the non-normal data can be tested using the t-test. That's the basis of the central limit theorem. And again, if the distribution in the both group is in the same direction, like both negatively skewed or positively skewed, then also you can apply this test. So how do you test this homogeneity of variance in Jamovi? So this homogeneity of variance hypothesis states that the variances in both the population from where the sample have been selected, that should be equal. And this is tested by the Levine's tests of equality of variance. And Levine's test, it tests whether the two sample which has come up from the population, they are having the same variance. So based on this, Jamovi gives two types of independent t-statistics. So the first t-statistics is known as the, if there is an equal variance. So if the Levine test of homogeneity, it states that the variance is equal. So when it states, so whenever the p-value will be more than 0.05, then it says that there is an assumption of homogeneity of variance is met. Because the null hypothesis states that the variances are equal. That's why you want to reject your alternate hypothesis. That's why the p-value will be more than 0.05. So when this equal variance assumption is met, then you take the value of standard independent sample t statistics, its degree of freedom, and its p-value. But when there is an unequal variance, that means this assumption of equality of variance is not met, then you click. We will see in the output in the GEMOV, then you have to click this Welsh T statistics, this degree of freedom, and p-value. So there are two scenarios. When this Levine equality of variance assumption is met, then we take the standard independent sample t-test statistics, its degree of freedom and p-value. When this variance is not, concept of variance is not met, then we take the Welsh T statistics, its degree of freedom and p-value. So what are the hypotheses? So underlying hypothesis is that the population mean of the two groups are equal. And the alternate hypothesis states that the population mean of the two groups are not equal. So now coming to the Mann-Whitney test. So I'll cover Mann-Whitney U test simultaneously because in the GEMOV, in SPSS, there is a separate option. There is a separate tab for this non-parametric test, and from there, you have to select this Mann-Whitney U test. But in GEMOV, it is there in the same interface. So that makes our life very easy because on the same, this thing you check for the normality and then you can decide whether you want to apply a Mann-Whitney, you want to click the Mann-Whitney, or you want to click the standard test. We'll see it soon. So this Mann-Whitney U test, like there are many times there is a variable which is not normally distributed. Like if you have done a study where you have collected this SGOT of alcoholic liver disease and a non-alcoholic liver disease, and there's a wide variation. In that case, you have tested for the normality, but you are saying that seeing that the graph is something like this. So if the graph is something like this, then you can say that the QQ plot, it is not normally distributed, because if you see these data points are not across this diagonal line. This is going like this. So if your QQ plot is showing something like this, then you cannot apply independent sample t-test. Then what to do? So in that case, you should go by this Mann-Whitney U test. This Mann-Whitney U test, it is used when the assumptions of t-test are not met, and it is a non-parametric test. And what it does actually, it arranges the sample data in the rank order, and then it compares the mean rank of the two group, and then it gives you the value of that mean rank as a median. So the research question is again, I have just changed that mean value with the median. So is the median SGOT level of population with alcoholic and non-alcoholic fatty liver disease are the same? Is the median post-operative pain as measured by the visual analog scale is similar for the surgical technique 1 and surgical technique 2? These are the same research questions which we have seen in the independent sample t-test. Maybe I think this third is a little different, like is the median Apgar score of babies born through the normal vaginal delivery and cesarean section is same or not? So in all these three research questions, what have we seen? That we are comparing median here. We are not comparing mean. And because we have seen from our normality graph, QQ plot, that we cannot compare the mean because it is not normally distributed. So if assumption is not met, I cannot apply the t-test. So you have observed that there is a scale variable and I want to compare it across the two categories. So appropriate statistical test. So there are certain assumptions of Mann-Whitney U. It is again the dependent variable should be measured on either ordinal or a continuous scale. Independent variable should be having only two categories, and there should be no relationship. That's the same which we have done, and it should not be normally distributed. And ideally, they should follow the same shape, either right or left. Then it would be good. Like in this case, you can see that both these dependent variable are not normally distributed, but direction of the skew seems to be same. So the null hypothesis is that the median of the two groups are equal, and the alternate hypothesis states that the median of the two groups are not equal. So coming to the questions, I'll first show you the questions. So this is the question. First, I have to, so we assume that by this time, because you have done the descriptive, so you know for all your variables, which are the data. That's the importance. So yesterday also we were discussing, like, first you should describe your data. Before you go for any test, you should describe your data. In that, it's important for you to identify the variables which are normally distributed, which are not normally distributed. Then at this time, it is not going to take much time to take decision, like whether you have to go for the Mann-Whitney test or you have to go for the independent sample t-test. So these are the variables: SpO2, CRP, HB, cortisol, LDH, and ferritin. And like if I have to see its normality, because on the basis of that, I can decide whether I have to do the Mann-Whitney or I have to do the this independent sample. So like suppose if I have to say that the mean SpO2 at the time of admission across smoking status. So how will I go? So from here, again, I'll go to this t-test and I'll click on this independent sample. If I click this independent sample, you will see there are many options. So first you focus on towards the left side. So here you can see there is a automatically clicked is the student, and then this is Welsh. So remember what was Welsh? So when the homogeneity of variance was not met, then we will click this. And then there is a Mann-Whitney. So when this normality is not met, then we'll click the Mann-Whitney. This is the mean difference. That means when you are clicking the student or Welsh, this will give you the mean difference between the two groups. This gives you the effect size, this gives you the descriptive, and this is the descriptive plot. So this is same like an independent sample t-test, one sample t-test, and then there are assumptions checked. So in SPSS also, this is not available. Like in SPSS, once you click that independent sample t-test, then only the result comes. But here you can check it beforehand, and then accordingly you can click either Welsh or student, and then you can see what to apply. So first, my role is to check for the normality of data. So what I'll do, this SpO2, I'll shift to the dependent variable. And you can see here by this scale, this is a sign of a scale. So in this, you can only shift your scale variable, and the grouping variable is your smoking status. So probably this smoking status, this is the smoker. So I have shifted this here. So now I have unchecked this because I'm not sure whether my data is normally distributed or not. But the student, it gives you automatically that value. So first, I'll go for the normality testing. So I have clicked this normality testing, and you will see not that this thing, because Shapiro-Wilk, I don't want Shapiro-Wilk because the data is. So in this case, you can see largely it is around this central value. Maybe if there is some confusion, like if you're not sure whether this plot is depicting, because it is little different from what we have seen, in that case, you can again go back to your descriptive and check with the other ways like density plot and maybe the, so I can go back to the descriptive and I can see regarding your SpO2 and smokers. So I'll be this SpO2, if I have to check this. So ideally is to check the variable across the group, because it will give you the two graph. So I have checked it across the smoker, split by, and then these I have unchecked because I only need the QQ plot. So this you can check here QQ plot, you can check the density also. So you can see the density. So it seems to be skewed. It is not normal. So then you can take a call and you can do the Mann-Whitney if it is not normal. So again, I'll come to, because this is there. So if it is not normal, then what I'll do, instead of this T, I'll click this Mann-Whitney. So this gives you the Mann-Whitney, and again descriptive I need because I want the median. And in this case, if the data is not normally distributed, you don't need to check for homogeneity, because homogeneity is only tested in case you are testing the mean difference. For median, you don't check this homogeneity. So you can see the median, it is 97 for the people who are not smoker and 93 for people who are smoker. So there is a difference of the median, but the interquartile range, because median we always express with the interquartile range. So for interquartile range, you have to go again to the descriptive, and then you can calculate the interquartile range group wise. So this was for the, if the data is not normally distributed. But again, like if you check some other variable, so maybe I'll shift it to here, and we can see probably maybe the systolic blood pressure. So you remember like which are the variables which were normally distributed. So probably this, maybe you can see this is across this line. So this is normally distributed. If then you can again go for the checking the homogeneity of variance. So if you click this homogeneity of variance, what will you see? What is the value of this homogeneity of variance here? It is 0.490. So 0.490, it says that this homogeneity of variance is met. It is why it is met, because the p-value is more than 0.05. And I want this p-value to be more than 0.05 because the null hypothesis for this homogeneity of variance state that there is the two sample which they have come from the same population having equal variance. So if that is met, then what will I do? I will check this student t-test. So I have checked the student t-test. It will give you the value of student t-test. Then you go for the mean difference, its confidence interval, and its effect size. So you can see that it will give you, this is the two groups. These are the smoker, these are the non-smoker 123 and 57, because you need to make the descriptive table also. I'll show you how to tabulate this. So this 133 and 57 are the number of non-smokers and smokers. These are the mean values. So 29.62 and 129.42. So what you will see that there is so much less difference. And you can see that statistically, if you see the p-value also, it is not significant because there is no difference, hardly 0.02 or 0.20. So that much difference, that's why if you see the p-value, it is not significant. So if it is not significant, then there is no point seeing in this effect size. And negative, this student statistics is positive. That means the upper this is a higher. So we do this minus this, the 1 minus 2, or the lower code minus higher code. So I don't want to use that lower higher code because then you will be a little bit confused. So just remember the first group minus second group. So this is how we do it. So this was for the, if the homogeneity of variance is met. Now let's say any other example where this homogeneity of variance is not met. Probably maybe I can shift it to here and I can take probably cholesterol. So if you take cholesterol and you see the QQ plot, so it is there. Again, this is also met. So then again, if somehow it is not met, then what will I do? Instead of this, I will click this Welsh. Okay. So this Welsh, I will click only when this Levine's statistics, homogeneity of variance. When it is less than 0.05, this statistics, then I will click this Welsh. Otherwise, I will not click this. I will always click this student. So now how to write the interpretation? So I'll go to that interpretation. So probably this, maybe for others, we could not give you the write-up, but for this, we could do this write-up. So you can just, one of you can read this.
Okay, ma'am.
Yes, Imran, can you read this?
Yes.
We
Okay,
have not given the values here. Remember, it is just a generic template where you can like give your variable accordingly. So probably this is the, what we have written, this is the your independent variable, the smoker and non-smoker, which is there in the row. And on the column, it is the dependent variable. So column is the dependent variable and row is the independent variable.
Shall I read, ma'am?
Please.
Yes, ma'am. Okay. So there were n1 number of cases of first level and n2 of level 2. The
So
mean.
N2, what is N1 is? What is N1 in the bracket here? So N1 is the sample size.
Okay.
So like there were 53 cases of smoker and 173 of non-smoker. So this level is for the category. And this N1 is the sample size in each group. Like in this case, you can see there were 57 in smoker and 123 non-smoker. Okay. Yes, please continue.
The mean DV1, DV2, and DVN across levels of IV were normally distributed as reported by visual inspection of the QQ plot to test the normality.
So IV is independent variable and DV is the dependent variable.
Okay. There was no or few significant outlier as evidenced by the visual inspection of the box plot. An independent sample t-test, Whitney was run to determine if there was the difference in mean and in dependent variable between levels of independent variables. There was homogeneity of variance / no homogeneity of variance as assessed by the Levine's test of equality of variances. And we observed a statistically significant difference / no difference in mean of dependent variable of patient having the first level of independent variable versus patients having first level of independent variable.
And in the bracket, you have to give the mean plus minus SD. So this is how you can do the write-up. And for if this is for like maybe LDH for the variable.
Ma'am, can you write in place of independent or dependent variable, the variable which you have like smoking or non-smoking? Because it's a format.
Yes, bilkul, why not? So you can write here. So maybe I'll change it. If you want that way, we can change it and we'll share that. We wanted that like maybe it will be easy for you, but if you find it cluttered and if it is creating confusion, then we may write the actual variable and you can again modify it accordingly. This will be shared to you. Do you want me to write now?
I think ma'am, yes.
Yes, okay. I'll just show with this this thing. So yes, let me see the result. So you can see the first level is the no. So 123 and 57. So probably I'll write.
I think one of us can just.
Okay. 123 cases of non-smoker. So similarly, like here, non-smokers. And N2 is the 57. I'll just show with one example. 57. So you can see here, this I can write 57. So 57 of, so why don't you take it as a homework? 57 of smokers. And then the mean of the SpO2. So you can write mean of SpO2 across levels were normally distributed. So across I'm just reading it out because maybe if I write, it will take time and then our breakout room time will be compromised. So I can write that the mean value of SpO2 across these smokers and non-smokers were normally distributed as reported by the visual inspection of the QQ plot. There was because in my case, there was no significant outlier. And independent sample t-test, because I applied Whitney, I did not apply. So independent sample t-test was run to determine if there was a difference in the mean SpO2 level between the smokers and non-smoker. There was a homogeneity of variance as seen by the Levine's test of equality of variance, where the value of Levine's test was more than 0.05. And we observed a statistical significant difference. So in this case, we observed no difference because the mean BP, if you see, it is only 0.20. The difference is only 0.20, this mean, not this median, because this is the, this was cholesterol maybe, but cholesterol, you can see there is a difference of 2.2 point. So you can write here, and if you come up, you can also see the mean difference also. So mean difference was 0.23. So you can write here that the mean difference of 0.23 was observed, which was either significant or not significant. So if you see cholesterol, then also you will see that it is not significant. If you see the significance value, cholesterol, and this is the p-value, which is not significant, right? So this is how you can write the interpretation. But if this independent and dependent is creating confusion, then we may correct it. But I hope this has given a message how to do the write-up. Okay. So Suresh is writing, please leave the template and modify. So the same thing. Any other question before we go to the breakout room? I'll once again summarize the command. So for one sample t-test, you have to go to this t-test, click this one sample, and then you can see there is a single window because here only one variable is there. So you need to move this. And then here the hypothesized value, you have to write that the way we used to write in the goodness of it. So you have to enter this, then click descriptive, effect size, mean difference. You have to check the QQ plot, the normality. And for this, again, independent sample and ANOVA, you go to the, and the Man-Whitney, you go to this, you transfer your grouping variable. So there are some differences, like in SPSS, you need to give the code of this, like what is 1, what is 2, but that is not required here. Again, you can shift multiple variable here, like which I forgot to tell. You can shift all the variables together and you can see it across a categorical variable probably. Like if you want to shift many variables, and if you want to see it across probably gender, then all these three, it will come together. If you click the descriptive plot, it will also give you the descriptive plot, something like that. In the same this thing, and again, it will give you the effect size, the mean difference. That will be the upper part, and then you can test the homogeneity also, and you can test the QQ plot. So you can test many variables also together at one point of time. If you're sure that which is normal and which is not normally distributed, then you can do that. And then accordingly, you can see if the homogeneity of variance met or not. In this case, you will see vitamin D and cortisol. It is meeting the homogeneity of variance. So you will click this, but this cholesterol. So now you can see this cholesterol across gender. This is not meeting the homogeneity of variance concept. So you have to click this Welsh instead of. So in that case, you need to take this cholesterol, send this cholesterol back, and then calculate student for each other. And then for cholesterol, you need to do it separately, because cholesterol, you cannot report this student, rather you have to report this Welsh statistics. Yes. So we may go to the breakout room. Basa?